Today we're in Amsterdam, where pharmacy leaders from around the world have gathered at a special meeting organised by FIP to talk about the wider use of pharmacists in providing vaccinations to the public. I'm with Darragh O'Loughlin, CEO of the Irish Pharmacy Union. Darragh, how have Irish pharmacists been contributing to public health in this way?
Since 2011, Irish pharmacists have been supplying and administering flu vaccine in their pharmacies to patients, and the number of patients who are accessing that service through their local pharmacy has increased exponentially since that time. We now provide approximately 10% of all the flu vaccines in the country.
And what kind of training do pharmacists receive in order to provide this service?
Before any pharmacist can start providing the service, they must do training which involves pre-reading and online reading, and then full-day attendance at a training course where they learn about vaccination technique, they learn about the importance of vaccination, the public health implications, and then more importantly, how to manage the risks, how to recognise anaphylaxis and how to deal with it should it occur. So that's the administration of epinephrine or adrenaline pens, and also, if necessary, CPR and use of a defibrillator. Then each year, before restarting the service in the autumn, pharmacists do some refresher training, which they can do either in person or online.
And in some countries where these services are provided, there seems to be a lack in terms of the records that are kept, in that pharmacy records might not be connected with GP records or with national records. It's a bit different in Ireland, isn't it?
Yeah, we don't have a proper electronic health record yet in Ireland, but for the purposes of vaccination, the Health Service has built an online portal where pharmacists record a vaccination in real time, recording who is the patient, what's their ID number, and then the vaccine itself, the batch number, the expiry date, all get recorded. It means that if a patient was to accidentally present in another provider's and look for the same vaccine, it would be obvious that they've already had it.
The flu vaccination service has been so successful that it's recently been expanded to 2 other vaccinations, hasn't it?
Yeah, we're consistently advocating for an expansion in the range and the number of vaccines that pharmacists can provide. So we were delighted 2 years ago when the Minister for Health extended the service to include pneumococcal vaccine and shingles vaccine.
And what have patient surveys revealed? Are they happy with the vaccination service through pharmacies?
Yeah, they're showing us 2 important things. They're showing us, firstly, that we are reaching patients who wouldn't otherwise have been vaccinated. Because what we're seeing is that for every 6 patients who come to a pharmacy for a flu vaccine, 2 have never had it in a pharmacy before. 1 of them has never had it ever before, and the other previously would have attended a doctor. But 4 out of every 6 are returning to the pharmacy for the vaccine because they were so satisfied with the service the previous year.
Well, that's great news. This is Lin Wang reporting from a special meeting on immunisations organised by FIP.